And we're live. Hello, it's Bill, the knee pain guru. Friday, May 6, 2022, the day after Cinco de Mayo. Welcome to the Ask Dr. Beck Show.
Good morning, everyone. I hope that Cinco de Mayo went well with you and that you're recovering from whatever you consumed on Cinco de Mayo.
Could be. So we're going to talk today about advanced ankylosing spondylitis with SIJ, SI inflammation.
Right. Involvement, yes.
Okay. Good info. Thank you. I wonder what you would recommend for those with advanced ankylosing spondylitis with SIJ inflammation and or fusion and pain. Thank you, Gretchen Bergman.
Okay. It is a question with more than one answer.
Maybe we should go over what ankylosing spondylitis is.
Sure. Can you look up a picture on Dr. Google?
I'm gonna do. Hold on a second.
That would be the easiest place to start. I can describe it, but if you can see a picture, it's of course worth 1,000 words at least.
And you need images?
Yes, please.
Okay, here we go. Let me share the screen here.
The right-hand bottom corner.
This one?
That one. That'll work.
Okay. Are you still able to? I zoomed it in so it's bigger. Is that able to be seen right now?
Yeah, if you can make that the only thing on the screen, that might help even a little bit more.
Okay, hold on a second. Is that better?
Just have the two of us at the moment.
Oh. Excuse me. Did that come up?
Working. There we go. That's perfect. Okay, great. All right. So ankylosing spondylitis is a condition that we commonly call bamboo spine. And we get that name because of how it looks on an x-ray.
Mm-hmm.
So what you'll see in the picture is on the top section, I have a vertebral body. That's the very top thing in the picture. And then the thing that looks like a donut that's a slightly lighter blue, that's the intervertebral disc where your arrow is. Mm-hmm. And underneath it, I've got another disc. And so the blue disc, we'll call that normal or mostly normal. It separates the bones of the spine. And it can provide cushion, but mostly it allows movement. Mm-hmm. When we look at the bottom one, what you'll notice is that the disc is either gone or it's hidden. And the edges of the bone start to grow together or they ankylose. Mm-hmm. And so what we have is a condition where rather than having nice, crispy, clean edges of the bones kind of blend together. And as they blend together more and more, they begin to fuse. Their motion becomes less. Okay, so that's the basis of ankylosing spondylitis. There's some blood tests that can determine some markers for it to see if you actually have it or not. And from a medical standpoint, what they tell you is there's not a lot that we can do. We can give you anti-inflammatories, but very likely, however you are in space over time is how your bones are going to fuse together. And so the advice is Don't live your life bent over, or that's the way your bones will fuse, and you'll never be able to come out of that. So it's maintain an erect posture, try to get things moving as much as possible, and thus keep them moving.
Mm-hmm.
So from a medical standpoint, that's about it. I mean, we can do, again, anti-inflammatory drugs or anti-rheumatoid drugs. So, for example, a rheumatologist may be able to help you, again, lessen the symptoms.
Mm-hmm.
But at least as far as I know, there is no known cure at the moment from a medical standpoint.
Mm-hmm.
Now, I'm going to change. I'm going to take off my doctor hat and put on different hats because different methods of thinking, either individually or combined, may be able to give us some insight into what's going on, both metaphorically and from a movement standpoint, and may be able to help guide us toward being able to help our patient even more.
Mm-hmm.
So, metaphorically speaking, you become rigid, right? Things stop moving. So, the first thing that I would look for, and this is in no way reflecting on an individual or their traits, just like if the shoe fits, it could be something to look at, is are you rigid and fixed in your thought processes, in
Mm-hmm.
your outlook of the world? And because mind, body, and spirit are interrelated, if your brain creates a system in which you are relatively fixed and things can't deviate too much, your body will follow along, right?
Mm-hmm.
So that is something where the realm of either a really good talk therapist or a homeopath might be able to help.
Mm-hmm.
Um, Also, what happens is our energy of the governor and conception vessels, the central meridians in acupuncture, gets sluggish or stagnant. And so an acupuncturist may be able to help.
Mm-hmm.
Massage therapist also is going to be able to keep things moving. And then for me, the big thing here is now, first of all, recognize that these people have, from a medical standpoint, what we would consider to be an autoimmune syndrome. So things are inflamed. So we've got to be careful with the kinds of forces that we use. But osteopathy, chiropractic, anything that's going to get the joints moving,
Mm-hmm.
and potentially take away the forces that are pulling those bones together. So this is one of those, hey, what we're seeing in the bottom picture is Wolff's Law in action.
Mm-hmm.
There's some force going on in the body, whether that force is inflammation, whether that force is gravity, or whether that force is trauma, but it's pulling those bones together and moving tissue away from how it was designed, the original blueprint it was designed in, to something that's different, something that's altered.
Mm-hmm.
So for those people, and I've seen a few in my practice, and at least now, from a movement standpoint, I've been able to help their movement. And of course, lack of motion equals pain. So if we can increase motion, pain goes down.
Mm-hmm.
So I've been able to help those people, and it's basically just trying to find out what is fixed in the body and help the body to then begin to release whatever it can and restore whatever motion is possible.
Mm-hmm.
From a Wolff's Law standpoint, if it moves, it can't fuse.
Mm-hmm.
So if we can get motion back in there, we can, at a minimum, delay the fusion, and at a maximum, prevent it,
Right.
which again then diminishes your pain.
Right. What is I'm understanding the disc, the blue
Yep.
the blue disc between there, the fusion of the bones in the spine if there isn't movement. where does the autoimmune component, like I'm not understanding how the autoimmune component relates to what's happening with the spine here.
So that we can get not too technical and relatively current, would you do a Wikipedia lookup of the same thing?
Sure.
I remember the blood test, and I remember the just rough basics. But again, because I'm not in rheumatology, so this is not what I do. I don't remember all the details.
It's a type of arthritis.
Yes.
Okay, gotcha. Hold on a second. Let me switch the screen here so I can. Did it come up the Wikipedia page?
No, I'm still seeing the picture.
Okay, let me. This is a little different than, like, if we do Zoom, share screen. There it is. Okay. Type of arthritis in which there is long-term inflammation of the joints of the spine. Typically, the joints where the spine joins the pelvis are also affected. Occasionally, other joints such as shoulders or hips are involved. Eye and bowel problems also occur. Back pain is a characteristic symptom, and it often comes and goes. Let's see. I think that kind of covers it.
Yeah.
It's
Yeah.
autoimmune compete.
And so I know what I was taught in medical school, and there are times when I question if it was correct, or maybe not correct, if it was complete.
Mm-hmm.
What I find is many people come in and their pelvises are tight.
Right.
Some people, they're significantly tight, and my job is to get them to loosen up and move.
Mm-hmm.
If we look at Wolff's Law,
Mm-hmm.
and Wolff's Law says things grow based upon the forces placed upon them, and we can interpret from that if something is not moving, then the body's going to fuse it together. Why waste the energy on trying to keep it separate? And so if those joints of the pelvis don't move, I wonder how much Wolff's Law plays into it. Now, there's no way to do a study that would be theoretically unethical to do that study, but you can certainly question if we took people who, let's say they had the predisposition to ankylosing spondylitis, they had the, let's say, a positive blood test, and we get them good body work from whoever it happens to be, just somebody who knows what they're doing.
Right.
Could we then keep that disease from progressing? And that then would be applying Wolff's Law to the body. If we keep things moving, they can't fuse.
Right.
And so that would be my thought process.
Yeah. I mean, there's a lot of, if we offer a different paradigm to how we're looking at addressing an issue in the body, everything could be different.
Absolutely.
Yeah. How is the ankylosing spondylitis the same or different than, what do they call those? Dowager's hump?
Yep.
You know, when people have
Yep.
those big lumps in their.
Yep.
Is that it? Is that the same thing, or?
No. So a dowager's hump is basically, I'll try to really simplify it. It's the bottom of the neck and the top of the spine. And it can just be an extra deposition of fat back there, which is often related to the adrenal glands and them being out of balance. But it can also be the neck tipped forward and those vertebrae in the back looking more prominent and then having some extra fat on top of it. So that's a dowager's hump.
Got it.
But theoretically, you still move. I mean, I have
Sure.
patients who come in with those at the beginning, and after a little bit of treatment, they get better.
Right. Yeah. Okay. We have a few people on the line. If you have questions for Dr. Beck and would like to submit them in the live chat, you can do those at any point in time. Sooner the better. We don't wait around. However, if you do, please enter those in there. We'll do a quick commercial here that you'll have a little bit of time to do that. Hold on a second. Where is our... Here we go. We're going to do a short commercial. Our mission at the Comella Foundation is to relieve pain naturally using osteopathic healing principles. The Comella Foundation is recognized as a nonprofit 501c3 under the Internal Revenue Code. Your contributions are greatly appreciated. Please consider taking a moment and donating to the Comella Foundation to help us continue our important pain relieving work. Every little bit helps. And we're back.
Awesome.
Cool. Is there anything else you wanted to put a bow on ankylosing spondylitis?
No, that's it. I mean, if wherever the person is, what I'd recommend is finding someone who does good body work and who understands how the pelvis functions or is supposed to function, and can help get as many joints moving as possible, as freely as possible, and go from there.
Got it. Well, awesome. Well, I think that's all we got for today.
Cool.
Anything else you'd like to share before we wrap it up here?
I think that's it. Got grass to cut. It rained yesterday.
Yeah, I know. Let's see. I got a lot of wood chips to spread.
You just turn the chickens loose. They'll spread them out and make them nice and even.
Aren't they? Isn't that amazing?
Yeah.
It's shocking to me. Yeah. Oh, we do have a question that came in last minute. Okay. This has been really fascinating. I appreciate your whole body approach and how you're looking at all aspects of us emotionally, mentally, and physically, and how that affects our health. Well, thank you.
Oh, thank you.
Okay. Well, Dr. Beck, Charlie, my friend, thank you for your wisdom, your insight, sharing your expertise with us. Have a wonderful day, you and everyone else watching, and we'll see everybody next week.
Thanks, everyone. Take care.